President Smith and distinguished faculty and guests, and especially the graduating class, it's a great privilege for me to receive this honorary degree. I am both a physician and a storyteller, and I want to share one quick story, if I may, with the graduating students. Many years ago, I found myself in Johnson City, Tennessee, a small rural town, taking care of many more patients with HIV than anyone had expected. And this was the days before we had any of the therapy that we take for granted. And so a lot of our care revolved around simply being with the patients, visit after visit, and watching them decline. And I remember one morning waiting to see a patient who I hadn't seen for a while, and I'd formed a bond with him. I looked forward to his visit. And the family called to say he wasn't coming to the clinic because he was too weak to come to the clinic. And yet he wasn't sick enough to be in the hospital. And I suddenly realized that I might not see him again unless I did something different. And so I elected to leave the threshold of the medical industrial complex that we all work in, and I went to the patient's home to see him, about a 1-hour drive from where I was. And when I got there, even though I had gone there for my own purposes, because I felt the need to see him, I found that my visit had a profound effect on the family and on the patient, helping them to come to terms with this illness. And when I left, I remember driving away thinking, wow, this is what the horse and buggy doctor of 100 years ago did so effectively in this country. The difference between healing and curing. I was able to heal, in a sense, even though I could not cure. And the analogy that I like to share with you is, if you were to imagine going back to your apartments or your homes, God forbid today after such a lovely day, you walk to your apartment or home and find that the lock is in splinters. The door is open. You walk through the house and everything is in disarray and all your valuables are missing. Your computer, your money, your jewelry, your cash, your iPad, God forbid, has been taken as well. You will be devastated. Not only have you suffered a physical loss of stuff, but you've also suffered a sort of spiritual violation. Someone has come into your sacred space and done something to you. And if the police come by an hour later and say, we found the person who did this, here is all your stuff back, you will be cured, but you will not be healed. Your sense of violation will be so strong that you might choose to leave the place that you're dwelling in and find a new residence. I'd like to leave you with the notion that all illness has these two attributes. There is a physical sense of loss, which we in Western medicine are very good at dealing with, but there's always a sense of spiritual violation. And with diseases like cancer, HIV, that sense of spiritual violation is huge. So I'd like you to humor me for just a second, if you wouldn't mind. Take a look at your right hands, if you would, graduates of this wonderful university. Take a look at that hand. I don't know how long it's been since you actually studied your hand and thought of it as an instrument. But I want you to recognize that that hand, in the case of many of you, will go on to do very specialized technical things. Others of you, it will control remote instruments that also do very specialized technical things. For others of you, it will be a writing tool, and your main work will be cognitive. But I want you to recognize that every one of you has a hand that has the potential to be laid on another human being and to provide healing even when you cannot cure. I wish you Godspeed on the journey, and thank you so much for allowing me to be a part of that special moment with you. Thank you very much.